Welcome back to our program. We introduce Michael Boyce to you now. Michael is the CVS RN Manager of Invasive Cardiology at Erlanger's Cath Lab. That's a lot to say, isn't it? But it means good stuff for us, that's for darn sure. And we're here to talk about what is called STEMI, our code STEMI. Explain what that is.
Well, it's a collection of letters that mean a ST elevation MI. It just describes the type of an MI, but what it really means is something that happens suddenly. The patient experiences chest pain, and it means, you know, go to the hospital, call 911, and at the hospital side of things, there's a whole system mobilized because what the patient needs is immediate care, and that's the goal.
And I understand that at Erlanger, this is like done 28 minutes quicker than what's considered the national norm.
Well, we're proud of that, and over the last decade, the chest pain accreditation and those kinds of things, American College of Cardiology, have come to appreciate the need for speed, not unlike the trauma experience in the years past. That once the heart is starting to be injured, the sooner it's fixed or stopped, it's better. And we gear everything about what we do in the cath lab to having that happen quickly.
Do you have a certain number of rooms or areas that you're able to, you know, in case 2 or 3 people come in at one time?
Yeah, we have 4 procedure rooms within the cath lab. And we have a team available 24 hours a day, no matter what. There might even be some people sleeping there tonight if the snow calls for it.
Is this one of those cases where you also have to depend on the patient to make the right call to, I need to get to the hospital? Yes,
that's a very important element. We don't need someone calling uncle and waiting for the family and trying to decide, because it breaks our heart, no pun intended, when we hear someone say, well, this started 2 days ago, because the window of opportunity really is the first hour or 2 once this starts.
Better to be safe than sorry, in other words.
Right.
Yeah, because I have known several people who unfortunately just went, but you would hear that they've been for a day or 2 having problems.
Yes.
But they didn't get checked out, and that's one of the good things. A person, is there any, I guess, particular time period, or is it best just to, if it goes for a little while, you know, say, I got to go and talk, better to be checked than...
Yeah, the classic presentation people describe as a crushing pain, so it's pretty clear that there's something very wrong.
Yeah.
The case that's a little bit out of the norm, though, is just something that doesn't, you know, it's not normal. And it depends also from female patients have a different presentation, and not everybody has the same, and that's unfortunately missed sometimes. So if there's something going on and it doesn't feel right, you know, that's what the ambulances and 911 and Life Force are all for.
Yeah, to get them there and get them there in a hurry. By the way, if you'd like more information, you can call 423-778-LINK, or you can go to their website, which is erlanger.org/faster. Okay? Good thing to know. Thank you, sir. Good to see you again. Now we join Mr. Food in the kitchen. It's time for South Beach Wine and Food Festival. Today